Hello, we're together with Professor Noel Wannang from Josh University. I'll introduce you to him shortly. We have the privilege of having Professor come all the way from Josh University to Wannang today, which is the other side of Josh. It's quite a drive. And it's his second journey out to meet us recently. So we're very privileged and thankful for you coming here today, sir.
I appreciate you.
And we wanted just to spend some time discussing about things that have become mutually important to us recently. We've just found out about Professor recently and reached out to see if we could form relationships so that we could learn from him in some ways that we feel are necessary to us. Recently at Christian Faith Ministries, we've, particularly in 2020, we've launched out into new farming programs. Because we've seen the depletion of our soils all around us here, and we've found out that we can launch out into better farming techniques that involve the rehabilitation of our soils, the building of our ecosystems, and to really help enrich farming life in this area. And also relationships. We found this is vital for the relationships between ourselves and our Fulani friends as well. And so we've made huge progress just in this 1 year. We now farm together with Fulani neighbours, Hausa neighbours, where we integrate our farming processes so that we can do it as a community, we can all benefit from it, we can all learn from each other. We've had veterinary experts from around the world involved with us as well, working on teams, collaborating in different ways. And while we've been doing this, we've found out that there are pharmaceutical things that we need to learn as well. And especially during this year of COVID-19, we've realized that we need to learn from on a more broad scale, integrate on a more broad scale, and see how we can bring in interventions for this virus, treatments, prophylactics, different ways of helping those that are sick. And also that we have a lot to offer here in Nigeria in that as well. We have herbal treatments. We have very rich knowledge. If you go back into previous generations, we found this in the farming community. There's very rich knowledge going back before synthetic chemicals. The older people here farmed very well, working together with animals and building ecosystems. We've lost a lot of that knowledge recently, and it's brought a lot of harm to our soils. We want to rebuild that. And we believe it's the same in pharmacology. There's a lot of herbal treatments that were very well known and are very less used in these recent times. And these are not only rich sources of medical or health care, but also this can build our economy locally. And so what we've been looking for is more of a collaboration between scientists and doctors around the world with local knowledge, building up this local knowledge, authenticating, if you like, or authorizing this local knowledge in the scientific community, so that we're not limited, by a sort of a narrow patent commercial world that we see today, but we're more broadly based and we can all benefit and profit internationally, especially Nigeria, which is what we're hoping for. And so we want to thank Professor Noel Wannang. Forgive me for my pronunciation. That's my upbringing. I blame my parents for that. But you are the professor of pharmacology and toxicology at Josh University, Plateau State, Nigeria. You are the lead researcher of Plateau State research team on COVID-19 and other infectious diseases, and Director of General Studies at University of Jos, and Secretary General of West African Postgraduate College of Pharmacists. So I've got to welcome and thank you for coming.
Thank you. Thank you so much. I appreciate it greatly.
Thank you. And I've got a list of questions, but if you can go off question if you like,
no
of course, but
it's okay.
Just a little preparation that I've done. So feel free to talk about anything you want to talk about. So my first question is, what are your titles and positions? But I think I've got that already. I asked you before we went on camera today. So could you please tell us a little bit about your current work?
Well, currently I am the person in charge of the COVID-19 research team on the plateau, like you said. When we started, we were given a mandate to provide a cure or a treatment for the ravaging COVID-19. I can tell you one way or the other that COVID-19 turned out to be a blessing to mankind, because a lot of us took things for granted. There were several things that we didn't do. When we were inaugurated, we started on the conventional drugs, and we repurposed some certain drugs into the treatment into about 6 different categories, from mild asymptomatic to severe instances with other comorbidities. But cardinal in our work is to investigate on plants that have antiviral property. Of course, there is no gainsaying that we know very well that the resources we have on the plateau, the resources we have in Africa, is so endless, and as a matter of fact, we have a lot of phytochemical materials that are very potent when it comes to therapeutics. So we now went into herbal search, and we did the in silico studies, and we had an array of over 100 different plant materials, looking into the phytochemicals, looking into what they do and all that. Eventually, we came out with 13 plants that have very excellent antiviral properties, and we subjected them further to some other analysis like the docking, the in silico properties. And we eventually found out that 10 of them can be very, very useful in the treatment of microbes, including viruses, including the COVID-19 that we are talking about. So what we did was, of the 10, we now did combinatorial analysis, and we came out with 3 combinations of agents that can be used for the treatment. And we equally have another formulation again, like in a Titsen, that can be used as a herbal tea, which is preventive. The mechanism of action is on the side of boosting our immune system, and then immunomodulatory, in short. So far we have reached very appreciable instances. We have even conducted, we are now on clinical trials. We are on the phase 1 clinical trials, and every result from our preclinical studies have been very exciting, very encouraging. We had to simulate the COVID-19 itself, because the isolation of the COVID-19 is not possible. As a matter of fact, COVID-19 seemed to be a particular virus that knowledge about it keeps
it hasn't
changing.
been isolated, has it yet? Really?
Yeah, knowledge about it keeps changing. Information about it, the mutation aspect. So we are finding it difficult to go deeply into the COVID itself. But what we can do, we have looked at all the symptoms, the presenting symptoms of COVID-19 vis-a-vis the lungs, the respiratory system, the inflammatory activities, the pain-related functions and all that. Most importantly, the pulmonary functions. So we have, at the preclinical level, we have done every experiment in the lab to see the possibility of our plants individually and in the combination that we have done. I must confess to you, we appreciate the results so far. If I wish I had come with some of the results so that you can see them, but we have equally sent them to plenty journals outside and within the country for publication, so that scientists and any other person around the world can see and then read from it. Maybe you can enrich our knowledge when it comes to herbal and medicine, which is actually an area that I am passionate about.
So you've said that you've looked at COVID-19 at the various stages of its diseases, from the early stage to the more serious stages.
Yes.
And how there can be interventions along those different stages, and that you selected roughly about 100 different plants, herbal plants that could have some benefits, some propriety that would help.
Antiviral properties, yes.
Antiviral properties, and then you've selected out about 10 of those, which you have then used to make up this treatment that you're now testing.
Yes.
Last time you came here, we had a brief walk around the site at Wannang site, just a brief walk. You identified several plants, and the friend that was with you as well, and how they have certain properties to treat certain illnesses. This is well known here. You also talked about different universities that have sponsored research into some of these plants. One ended up, you talked about, became a capsule to treat, I think it was diabetes from a plant we found up the back of our property. So these have been properly researched and developed into authorized drug use in this country. And when you look, there's a lot of people I speak to here that are not wealthy, and they treat themselves using this knowledge, because that's some of them, it's the only option they have, because normal pharmaceuticals, modern pharmaceuticals, so to speak, are very expensive. One person showed he had an app on his phone, and an app on his phone that listed all these different treatments from different plants that people are using now to treat themselves at an affordable level. But we've often thought, and I think people also from my background, we've been brought up to think that herbal things are unsophisticated and so on. Okay. And I think that's wrongly part of our culture. I think like this began when the modern pharmaceutical took off. These ideas were sort of became dominant, and it's sort of like it's become a monopolist situation in my Western culture. I know it has, where these other things are pushed out, and sometimes it's for commercial reasons, and we're losing because we're limiting ourselves from this great rich knowledge that our parents. You said that it started with you with your parents. This journey of yours.
Let me correct an impression. First of all, I'm a pharmacist, and drug discovery is purely a pharmaceutical business. I'm a pharmacist, I'm a pharmacologist, and when you look at it, right from the beginning of creation, there have been humans. Right from the beginning of creation, there have been sicknesses. Come to think of it, what have they been using to treat those ailments? And those people lived so long. Trace it from the Bible. People lived for 700 years. They never got ill. And when they were ill...
And I believe that's true, by the way. Some people discount that as sort of, Old Testament mythology or something. But I've looked into that a little bit.
Okay.
And I mean, I think that's the truth. They did live a long time.
Whatever, they lived a long time.
I believe that, yeah.
And then let's look at it this way. Before then, there were herbs. When you trace right from the Bible, if you open Genesis 1:29, if you open Revelation 2:22, Ezekiel, you see several citations and quotations where herbs have been used to heal mankind. There are more than 50 various quotations from the Holy Book which talks about herbs. If it is so, then that means along the line we missed it. It will amaze you to know that plenty drugs today in modern world are from herbal remedies.
Yes.
If I pick on some few drugs like Digitalis purpurea and Digitalis lanata, that is the only source of digoxin. And digoxin is a main drug which still today is used in conventional hospitals in the treatment of congestive heart failure. Then let me pick leukemia. The drug that is used for the treatment of leukemia till date, anywhere in the world, vincristin, vinblastine, these two alkaloids are from a plant, Catharanthus retius. I can go on and on. Even the quinine that we take from the cinchona plant. Aspirin is even in the Bible. When you check the willow bark in the Bible, that is the source of aspirin. Artemisia annua is a plant that had been used over 2,000 years ago in China. Today, we are celebrating it as a drug in the treatment of malaria. The list is endless. Even from our conventional antibiotics, from the ampicillin, streptomycin, all of them, from Penicillium notatum, from Streptomyces aureus, so many of them. Invariably, more than 70% of modern day drugs are obtained from herbal remedies. The only problem that we seem to be having when we talk about herbal remedy, we are being misconcepted to be those traditional herbalists that are illiterates, that are walking the streets, pushing these things in wheelbarrows, pushing them in open trucks, and then selling them in paper bags, selling them in animal skins. The illiterate farmers. That's the concept that people have about.
I think they call it snake oil in the West or something.
That is the concept, unfortunately.
Fake business people.
But when you look at herbal medicine in the modern era, to which I belong to, which I've been conversing about, We are talking about plants isolating phytochemical materials and all that.
Well, it's fully scientific.
Fully scientific. If we had wanted to make a declaration on our COVID-19 drugs, the week they inaugurated us, we'll have long made that declaration. But we as scientists, we have to make it in such a way that it should be presented with best global practices any part of the world should accept. That is why we're going through the rigors of preclinical studies and clinical studies like any other conventional drug. I had been in this game of research for more than 30 years, for about 30 years now, 3 decades. And if I walk in the field and I see several plants that have been, I know their medicinal values, people have used them, there are testimonies. But of course, as scientists, I don't believe in testimonies, I believe in scientific results. I have investigated on several plants and I've seen their efficacy, I've seen their safety. I have known the individual phytochemical materials that can be exploited.
Yes.
All we need is a kind of a collaboration. These things are there, these things are working, these things are so abundant.
Yes.
Most of the population in Nigeria, when you look at it, about 20% are the only population that have access to modern facilities.
Yes.
Over 70 to 80%
Absolutely.
are patronizing natural sources.
Yes.
And they are well, they are getting their health. If government had looked inwards, which is an advantage now to COVID, whereby we have started looking inwards into the treatment for COVID. If government had long ago looked inwards, they are going to see the gold mine. Each leaf you are seeing represents maybe dollars on the tree. By the time we look at that, we now encourage through collaboration, research facilities, human exchange and ideas. We pick out these plants, take them to the lab, exploit to extract the particular phytochemical that is responsible for this activity. We are going to benefit the same manner that I've been listing all those numerous plants that till date they are still used. Permit me to, you mentioned the field I went to, the sponsorship we had. This thing was about 10 years ago. A plant had been useful for several ailments, diabetes mellitus, etc. Until a certain individual made a sponsorship, made an advert for sponsorship. And then incidentally and locally, we got it. I was opportuned to be in that committee. I did efficacy and safety studies. And in the span of 6 months, 8 months, we were able to bring out results that can stand the test of time. We brought out results that were subjected to rigorous academic and scientific fireworks, and eventually they found out that the drug is actually very, very efficacious in the treatment of diabetes mellitus. As a matter of fact, it was eventually capsulated and sold in the open market. There are several other drugs like that. If I am to bring you back to the COVID, the recipe we have for the COVID-19, of the 10 plants, I as an individual have personally investigated on about 5 of them on their antiviral properties and have been published in journals in the UK, journals in the USA, and journals in Africa, several continents. My publications have gone around on the individual efficacy and capacity of these plants. By and large, if we can have a collaboration from the industries to the academia, from the academia, we cannot forget the political will. We are going to create a bridge, and that will be of maximum benefit to mankind. I'll tell you, several persons in the village, they are equally aware that these drugs are efficacious.
Yes.
The only thing you need to do, as holistic as a drug is, it comes in with several other components, the good, the bad, and the ugly. As a scientist, I am to expunge the good ones, the phytochemical materials that are very useful, and I discard the ones that I know they could be responsible for the toxicity that we are seeing. And that can only be done when we have some larger scientific opportunities, laboratory collaborations, intellectual exchange with scientists across the globe, and most importantly, the funding and the political will.
Yes. I think when we push these other treatments out of the market, then people self-medicate, and it can be dangerous, and so it's much better to bring these in, regulate them properly, make sure that there's proper knowledge and people take these things in a safe way. One of the things I like here is that we can see that the current president has been doing is encouraging the growth of agriculture at home and stopping the swamping of imports. And you see this a lot over the years. It's just so many things being dumped and suppressing local industry and the growth of local knowledge.
The pharmaceutical industry, sorry to cut you, the pharmaceutical industry suffered that a lot. Nigeria has over 470 pharmaceutical industries.
Yes.
And in this over 470, just less than 70 of them are local manufacturers. And within the 70 that are local manufacturers, just 4 of them are WHO certified.
Yes.
And all these companies have been listening to you. Simple mathematics. If you have over 470 or 492 pharmaceutical industries, and out of that, just about 70 are local, it goes to say something is wrong. We have suddenly become a consumer nation, a dumping nation.
Yes.
So everybody, the importers, know that there is business, there is exploitation in this area.
Yes.
That is why you have a majority importing and very few are local manufacturers.
Yes.
The problem with the local manufacturers now is that the competition is going to be too stiff and too high. Most unfortunately, Nigerians have this psyche that what is imported is better than what is local. So the local producers are suffering, they are suffocating under harsh policies, under harsh business environment, on the harsh culture of the persons. In between that too, it will amaze you to know that the local manufacturers are actually not manufacturers, they are compounders. Because 100% of all their raw materials are imported. Meaning you just import and mix, but you call yourself a manufacturer. We should also encourage the production of raw materials. If it is so, we have endless opportunities in Nigeria. Look at starch, for instance. We still import starch. You can get starch from cocoyam, you can get starch from cassava, you can get starch from yam. I can name, there is no family that doesn't eat starch every 6 hours in Nigeria today. And yet, we are suffering. We have to import starch from another country.
People profit from this, and I suppose...
Of course, people benefit a lot from it.
From the current
the
arrangements.
frustration of the local manufacturers, the importers are hugely benefiting, and they will do everything humanly possible to continue suffocating the local manufacturers so that they make their financial benefits. Of course, I wouldn't say that it is very probable too that there are some people in policy making that are equally benefiting from the largesse of the importers, to the detriment of the local manufacturers, and to the detriment again of the consumers or the patients.
I think that, from my perspective too, as a visitor, a foreigner, we've been in Nigeria for 30 years, but this aid, you got aid coming into countries, but the aid in many ways it sustains this current system because it's foreign products that are coming in. It's more markets for foreign products that are given through aid and philanthropy and so on. I think, organizations, and I know this is very big and beyond our discussion here, but organizations like the United Nations, if they can be promoting this sort of development, that instead of aid, collaboration, it won't profit necessarily outside groups, but for us to work together to develop home industries and the home scientific community, because we have very good universities in this country with very well-trained people, and just waiting for this collaboration. Not only is it going to benefit this country, but it's going to bring so many more products online that will benefit people around the world, so many more treatments that are going to open up. So this current system is, everyone is losing from it.
Everyone is losing.
United Nations talks about things like, these nations need abortion and all these. But no, so that the poor children won't suffer. But no, they need collaboration. We need development, and we need to join hand in hand and work. It might not benefit our rich companies, but it's going to benefit the world. It's going to benefit all of our nations. So we really need this.
We need it. You see, the other aspect again, most industries are profit-oriented. Profit targeting. That is an unfortunate culture. There should be policies that should look at research and development as the only recipe route. Companies may not be able to sponsor researchers in the academia. Companies may not be in a hurry to pick any product in the academia. If you go to my university today, and there are about 26 other pharmacy universities in Nigeria today, every of these pharmacy faculties are doing elaborate researches in herbal medicines. They have so many products, but they end up on the shelf because they don't have the wherewithal, they don't have the money to propagate.
I think this is an international crime
Yes,
because it's killing people.
it's killing people. But you see, unfortunately, I'm an African. Africans don't die; they are always killed.
Yes.
When something happens, they don't look at it that you have died. They will say they have killed you.
Yes.
So diseases, people are dying of them. We are seeing them, but we now attribute it to some spiritual manipulations.
Yes.
We associate it to some.
In our country, it's the mother-in-law.
If we come to terms to agree that each life is useful, each life is meaningful, if we come to terms to also agree that we can develop the solution to each of these problems, we can surmount the problems in terms of health, in terms of drug production, in terms of research, that will be the beginning of where we're going to start appreciating human life and most likely appreciating what God has given to us on the plateau, in Nigeria, in Africa. We have a lot of resources.
I know. It's big, isn't it? It's moving away from the primary business model, and we need business, we need finance.
We can go along. The business can be there, no problem.
Primary
yes, but the primary
humanity.
focus should be If not for that, most of the drugs that we're using today, people have not made a sacrifice. They couldn't have been there.
Yes.
Somebody said if you eat hot food early in the morning, somebody didn't sleep to prepare it for you. The problem is people are not ready to sacrifice and prepare the hot meal for others to benefit. I told you I've been in this research business for a very long time. I'm not researching because I want to benefit directly from it, but I'm researching because for the future, for mankind. It is possible. Yes. My discoveries may save millions. Yes. It is possible that I may not be alive to know what has happened after my exit or something. But I am happy that I'm into research. I am happy that God has given me the opportunity to go into research and herbal medicines, which I have promised not to fail in it.
Yes.
If it is so, that culture should be developed in our scientists. The culture also of sacrifice should be developed in our industries, which could be through government policies.
Yes.
And then humanity in general should look at the research in herbal medicines or research into drug discovery as a panacea to human and human development and growth in general.
Yes. And coming down to the doctor-patient relationship, one of the things that I've just heard recently, in the last couple of days, that came out of the Second World War and what happened in Germany in the Second World War, the
chloroquine discovery.
Well, no, I'm thinking of the interference of the Nazi government in the medical community, and how it led to a lot of bad consequences for humanity. And at Geneva, a couple of years after the war, they made one of the resolutions of Geneva was that the sanctity of the doctor-patient relationship, and that no government has the right to interfere with that sanctity and begin to prescribe how the doctor can treat and how the doctor can't treat. And I think in this COVID situation, we've seen on a global level, we've seen a bit of interference in that some doctors have been suspended or censored and so on. The sanctity of that relationship. And I want that. When I go to a doctor, and I'm not speaking here of course, in any medical professional capacity, but as a patient, when I go to a doctor, I want to know that doctor, his primary concern is me and his responsibility to me, not how he's going to be disciplined by someone else. Is he telling me everything that's good for me? Is he speaking to me in my personal best interest and telling me everything that is good for me to know? And we have had I've heard many times where people, nurses, doctors, have even wanted to bring forward some herbal treatments and just recommend them, and have been disciplined by their colleagues. Maybe not even disciplined directly, but maybe it's just peer pressure. Maybe it can be ridiculed. We haven't had the proper double-blind test on this, that's anecdotal and so on. And yes, there is the need to protect the patient, but this can also be used to establish a monopoly and so on. And I've seen this in the medical community, and my heart is to say, well, we want fellowship, we want respect, we want the dignity of everyone contributing, of everything coming to the table, yes, in a scientific way, yes, to protect the patient, but not in any way to push something out. And so we want medical practices. We desire, this is our heart, because by God's grace we have a little medical centre here, and we're hoping that God will bless it and will grow. But we want all of these knowledge and fellowship and respect, and everyone coming to the table, yes, with proper regulations and make sure these things are done in a very accurate scientific way. We want to bring these together in medical treatment. Is that happening in this country?
Well, okay. Well, I'm happy about this, but I agree with you to a certain extent, and probably would disagree again in some areas. For instance, there are work ethics, etiquettes that must be followed, and human lives are sacrosanct. They are not things that can be played around with. There are professional ethics, there are rules of engagement, the confidentiality of the patients, and all that. Most of these things you have said came to bear during this COVID-19 because we have a lot of debates from doctors, from pharmacists, from healthcare providers, from leaders, from politicians, and it left the entire world confused. I appreciate you for that. I appreciate the angle to which you are looking at it. And of course, you are looking at it from the position of a patient. And patients are impatient, always in a hurry to get a solution. So wherever the solution is, you rush to where the solution is. If it is so, today, if somebody tells you that he's got a drug for the treatment of COVID, you rush and drive to the place. Tomorrow, somebody tells you he's got another one, you rush to the place. If it is not properly regulated, we'll end up having a lot of poisons and chunks being dumped into humans. And that explains why we have some ethics that you must follow. Declarations on the social media that I read, or I heard about certain individuals or persons celebrating the discovery of a certain cocktail or certain combination of drugs. It is unscientific. Unscientific because we all know that there are protocols for declaration. There are processes that you must follow. In every profession, you are guided by ethics. You are guided by laws. And if, because of the urgency, you can apply for an exemption of the processes if you want to make a truncation, but not for you to go on a social media. I must tell you too, COVID-19 is a pandemic disease. COVID-19 is also infodemic. The information destroys more than the virus itself. Everybody listen to anything, you rush into it. Recently, we had Ebola. When Ebola came into West Africa, into Nigeria, the one I know, they said you should wake up 5 a.m., have a cold bath with salt, drink salt water, and several persons died out of that. It's not true. It is scientifically baseless. Same with the corona. Several experts in quotes also projected certain recipes, certain formula. If not for the ethics and the regulations, we will have recorded another bout of casualties.
What we're seeing today, though, I think too, is that these ethics can be used for commercial to protect industry for people with vested interest. And so if you get something like hydroxychloroquine.
Oh, that's what I was saying the same. I'm saying if you can apply for exemption, then of course the ethics is not as rigid, it's not the rule of thumb. When you have a peculiarity, for instance, in a pandemicity, you can exempt so many protocols of ethics and then come to the rescue of the patient. And that explains why suddenly we had a Madagascar influx of herbal remedies.
The Madagascar
drink,
the potion for COVID-19.
And then certain areas celebrated it. Nigeria brought in a huge quantity of these drugs. And after so much scientific bombardment, made a declaration again that COVID-19 was merely anti-malarial, etc. That I don't know the details of that investigation. But that is also to give us a guide that we must have a regulation, we must have a guide. Definitely, the patients are eager. They are eager to have a solution. So they will look at the scientific world that they are wasting their time. they should quickly jump into this. But the ethics sometimes is over bloated.
Yes.
When you look at the doctors' ethics, the pharmacists' ethics, the nurses' ethics, you will see some conflict into the ethics, and then you will see some unnecessary celebrations within them and to the detriment of the patient. Nigeria is suffering that a lot. Nigeria is suffering that hugely. The multiple various layers of professionalism and interference is so unfortunate. The leaders are not helping issues either, because if the leaders are going to be true to themselves, every profession has its own mandate, every profession knows the rules of engagement and the limit to their practice. If we can do that, we are going to have a lot of benefit. Unfortunately, in about 190 countries in Africa, I think in WHO ranking, Nigeria is 187. That is very poor. Some smaller countries in Africa are ahead of Nigeria because they have a well-defined health structure. But Nigeria is still lacking. We don't have a well-defined health structure. Commonly, you see intra-clashes within the professions, inter-clashes between the professions, and it's a win-lose situation. So professionals, a certain sector will want to win to the detriment of others, and it is drawing the health sector backwards, and the patients are suffering. But unfortunately, nobody is talking about that.
Well, I think we've seen similar. Again, I'm not a professional, but I've done a lot of, looking into this because it has been a concern to myself. But the vested interest in certain drugs that might be approved, like for COVID-19, and others like hydroxychloroquine, for example, is very cheap and there's no patent on it, and the studies that have come out in favour, not just doctors using it. It will amaze you to know that in our own committee, the research committee on COVID-19 on the plateau, we have looked at hydroxychloroquine, we have looked at azithromycin, we have looked at zinc, we have looked at several other conventional drugs, and we have repurposed them. All these drugs I've mentioned to you, they are part of our cocktail that we have recommended to government, we have recommended to the prescribers, we have recommended to the healthcare providers. One of the head doctors of Yale University came out, recent months, and has been saying how important
they have gotten good results from the repurposed drugs that we have.
But in Australia till today it's banned. Doctors are not allowed to prescribe it. They'll lose their professions, and people are dying, and
it's unfortunate. So, I think the COVID, unfortunately there seems to be an imbalance between politics and science. Maybe the politics overwhelmed the science, and the scientific world became confused, and the patients became the punching bag of the two debates.
That's right.
That's the most unfortunate part.
When I talk about merging Herbal
and Orthodox,
and like we talked when we had a conversation together a couple of days ago, we talk about orthodox, or is it alternative treatments, and and we've talked about. You said in the beginning, creation, we've had herbs were given to us. So I don't really see them as alternative. I think that God put a lot of treatments, but when I and that should nutrition, good way, that should be our primary basis for health. And maybe synthetic chemicals can be alternatives if we need them.
If I am to make a comment on that, it's unfortunate. The English language I was taught, alternative is what comes after. That was what they taught me in English language in my college days. What you meet already exists. If that one fails, then there's an alternative. If it is so, plants existed before synthetic drugs. Plants existed before synthetic drugs. If it is so, people have been using herbs to treat various diseases. If it is so, then plants will be the orthodox. Then synthetic drugs will be the alternative because they came later. But unfortunately, when civilization came, civilization turned everything around, and they made plants to be alternative, and they even further derogated plants by saying it is herbal traditional medicine.
And the synthetic drugs can have a lot of side effects.
Oh,
so if you
synthetic drugs,
take this, in a few years you'll need to take another one, and you need to keep adding.
Synthetic drugs, in comparison, synthetic drugs have more side effects than herbs. Herbs are natural.
Yeah.
They are natural, and we eat.
Yes.
All we eat, they are herbs.
Yes.
The spinach we use as
Yes.
vegetable, the lettuce and cabbages we use as vegetables,
Yes.
they are all herbs.
Yes.
All of them have medicinal values.
Yes.
So, rightly put,
vitamins, everything.
yes, rightly put, every day we are using herbal medicines unknown to us.
So I fully agree with synthetic, and we need
Alternative. We need
modern interventions.
We need interventions. We need herbal medicines. We need to encourage research into herbal medicines. We need to encourage the extraction of phytochemical materials, and we can even look at it side by side, like a collaboration.
Yes. So when I talk about bringing these together in a medical clinic like we have here at CFM, I'm meaning in this rigorous scientific way, so that to make sure that the patient is protected, but also to make sure that we do bring in all this knowledge.
It's a perfect thing to do.
Yeah.
It's a perfect thing to do.
And this is encouraged in Nigeria.
Yes.
More these days, I think, isn't
Yes.
it? That you do get scientific and communities and medical centers trying to bring these things together more. Is that happening?
It's a perfect thing that you are making a proposal with CFM here. As a matter of fact, you have a very good base to start. You have the environment. You equally have the opportunities to build your community and the outside community. Unfortunately, outside Nigeria, the practice of the herbal medicine and orthodox is not very, very encouraging. It had been on paper severally that they want to encourage to integrate herbal medicines with orthodox medicines. It has been a long information on paper, but realistically, it has not been possible. And that explains, again, why some other countries are advancing in herbal medicines. For instance, Asia. Asia has long integrated herbal medicines, and Asia. Yes. India, China, they've long integrated. And that is why their Chinese drug of artemisinin, the Artemisia annua and the derivatives of artemisinin have found a place.
It has incredible properties, Artemisia annua.
Yes, Artemisia annua has incredible properties.
And I looked at some of the protocols in Chinese hospitals, had to translate them into English.
Yes, and if you look at the weather on the plateau, do you know that this same artemisinin that we've been talking about had existed in Nigeria equally over 100 or 200 years ago too?
No.
We even have Artemisia annua being cultivated somewhere in a lower plateau at the Lantern area, and the percentage yield that is gotten from that one is higher than the one gotten from China. That's to tell you that the weather is perfect, the environment is perfect. All we need is a political will. All we need is the advocacy to know that yes, this is truly work. What we need to do, let us do it to the best scientific scrutiny and to the best global practices.
Well, what we're praying for at CFM is at the moment we're working on a larger hospital building, and to have, what do I call it, orthodox modern medical treatment. We want that, as best as possible here.
Yes.
An X-ray unit as well. We're trusting God to have diagnostics for HIV and hepatitis B here, so that we can diagnose it properly, treat it properly here. Because in Barkin-Ladi, we know there's a very high incidence.
Very high incidence, not just Barkin-Ladi here.
Of HIV and hepatitis B.
Yes.
And so we're really wanting to be a centre for this region here. But also we want experts. And I've been looking for experts like yourself so we can learn about this.
I am
so
willing.
Thank you for responding.
I am willing to be here.
Yeah.
In fact, if, like I mentioned to you last time, if there's any gathering that you want me to talk about herbal medicines, about complementary medicines, the integration of all these to the population, to the community, or to your students, I will gladly come.
Well, we were planning this before shutdown, but after lockdown's finished, we want to have
I will gladly come.
a gathering where we bring stakeholders together.
Yeah.
We really want to speak about the things that build our local economy, whether, integrating with all our ethnicities.
But you could even start a medicinal garden.
Yes.
You could even start a medicinal garden.
We're starting one now. We've already employed some.
That's a very perfect way to start. And then you start growing them. You may not have the space for the massive cultivation, for the industrial cultivation, but let's start from somewhere.
Yeah.
By the time we start, it's going to create opportunity for labor, employment for people.
Yes, yes.
If you go to the field, let me give an example. One of the cocktails that we're using in this, our COVID-19, is the common fruit in the bush, in the field, on the mountains. So by the time we harvest that, and that comes to be a drug now, you can imagine the number of opportunities and employment, the economy that this country is going to raise, poverty line being crushed, and a lot of other things. It's a good development. It's a good way to start your medicinal garden. I will encourage you to do that.
Yeah. Anything else you want to talk about before we finish?
If you want me to.
Well, I don't have any more questions. I have a few here, but I think we've covered most of them.
Okay.
Yeah.
Give me an area.
Well, I think I've covered everything. So
Okay.
So maybe another time.
No problem.
Okay. Well, we look forward to having a gathering, a conference, and for having you to speak.
I would be glad if you can organize a conference. We can start locally here. Even your students, we can train them.
Yes.
Have a class with them. It will amaze you too. They will tell you the knowledge of what they have on plants.
Well, we want Christians. We want Christians who want pastors to come to understand these things as
the ordinary
well.
foods that we eat, they are also medicinal. If I'm to go back to nutrition and health, in those days, people were eating local meals. Permit me to use some names of soups that you may not know. In my local place, we have a soup called miyan kuka. Kuka is from Adansonia digitata. That's the botanical name. And the only ingredient that they could be using is salt and water. And these people will live for 70 years, 100 years. They never got ill. Today, we have people that eat foreign imported canned materials, a lot of preservatives.
Well, is it true too that there's an increase a big increase in diabetes and hypertension?
That's what I'm going to now.
Has that got anything to do with the change in our farming methods, our petrochemicals, and that?
That's what I'm going to now. Today we have foreign foods. We have canned meals.
What's that? Canned
food,
processed
processed foods.
Yeah.
And what they use in the can, they use the cadmium. Cadmium is used as that shiny thing in the container so that it doesn't get rusted. Fine. And cadmium is carcinogenic. It is a poison.
What I love about my time, I spent about a year in Nigeria at a time, is I don't eat any processed foods or nothing.
But because you have a background exposure.
I know I don't like processed foods.
Fine.
When I come
but
here,
I can tell
everything's
you in
fresh.
Nigeria too, because of class distinction.
Yes.
If they see you eating canned food, you are a big man.
Yes.
If they see me eating roasted corn by the side, I am a poor man.
Yes. And
So
what,
that
baby formula for milk instead of breastfeeding.
that attitude
it's
has
all
really, really damaged our health. That's why you look at the incidences of diseases that in those days, cancer was alien to us. Cancer was alien to a black man, to Africa. But cancer is so prevalent now. You see it almost everywhere because the foods we eat, we have so bombarded and insulted our natural immunity. The body system is so confused because there are some foods, take it or leave it, there are some foods that are race specific, genetic specific. When a Caucasian eats, when a black man eats, the responses are going to be different. That's what we call idiosyncrasy. If it is so, and we now unfortunately believe that the foreign things are better, so we keep on eating foreign rice, we eat foreign canned foods, foreign
Well, I think the Caucasians are getting sick as well. So
no, everybody gets sick. Everybody gets sick. But there are diseases that are peculiar to races. There are diseases that are peculiar to races.
yeah, but like hypertension, diabetes, cancer, these are the big ones, aren't they?
In those days, cancer was alien to Africa.
Yeah.
But now cancer is very, very, you see cancer incidence is on the rise.
Yes.
Diabetes, hypertension, these are some 30 years ago were not very common.
Yes.
But you see them now very common. Why? Because of the foods that we eat.
Yes.
You have more processed foods in homes than natural foods.
Yes. Well, thank you, Prof.
You're welcome, sir. I appreciate you greatly.
So as two Profs speaking, I'm a Prof in New Testament theology. So here I'm trying to speak about herbal medicines and science and hospitals.
No, I'm really encouraged.
But it's
That's
biblical.
beautiful.
It's biblical.
Yes.
God gave us the leaves
Exactly.
for the healing of the nations, and so we want our health back. So thanks for coming to
I
talk to us
appreciate you
today.
greatly.
God bless you, sir.
Thank you so much.
God bless you. Thank
Yeah.
you.